Welcome everyone to our Fireside chat for today. This is going to be 195th webinar. And today we're going to look at going back into a pragmatic webinar series. My name is Dr. Yuri, and I'll be the moderator for this session. And today's session is going to be on an interesting topic on exercise in chronic kidney disease. And we're going to look at lessons from the Global Exercise Network, abbreviated as GREX. And it's now my pleasure to introduce our guest speakers for this webinar. So our first speaker will be Professor Ken Wilund, who holds a Bachelor's of Science in Nutritional Sciences, a Master's in Public Management, and a PhD in Kinesiology from the University of Maryland, College Park. He completed a PhD research fellowship in cardiology at the University of Texas, Southwestern Medical Center in Dallas. After 19 years as a faculty member at the University of Illinois, he recently transitioned to become the director of the School of Nutritional Sciences and Wellness at the University of Arizona in August of 2023. His research focuses on developing innovative strategies to enhance the health and quality of life for patients with chronic kidney disease, a population often burdened by multiple comorbidities, recognizing that exercise and nutrition interventions are underutilized, yet highly beneficial. His work centers on two key areas, increasing physical activity in CKD patients and reducing cardiovascular risk through better management of volume overload and hypertension. To advance these efforts, he founded the Global Renal Exercise Network, a worldwide collaboration of over 400 researchers, clinicians, patients, and industry partners dedicated to promoting lifestyle-based therapies for CKD. So looking forward to hearing from him with quite a very rich background. Our next speaker after him will be Dr. João Viana, who is an associate professor and Vice-Rector at the University of Maia in Portugal, where he also coordinates the PhD program in sports sciences. He serves as director of the Research Center in Sports Sciences, Health Sciences and Human Development, and vice director of its national consortium. Dr. Viana earned his BSc in Sports Sciences and Physical Education from the University of Porto in 2004, followed by an MSc in Exercise Physiology, which he attained with distinction, and a PhD from Loughborough University, where his doctoral research focused on the effects of exercise on immune function and inflammation in chronic kidney disease patients. His research explores the role of exercise in chronic diseases such as CKD, cardiovascular disease, and diabetes, with particular emphasis on immune function, inflammation, bone and skeletal muscle metabolism, and the clinical implementation of exercise interventions for dialysis patients. Dr. Viana is actively involved in several professional organizations, including the Global Renal Exercise Network, the Portuguese Association of Exercise Physiologists, and the Portuguese Association of Kidney Disease Rehabilitation. He also contributes to national health initiatives as a member of the Scientific Committee of Portugal National Program for the Promotion of Physical Activity. So looking forward to this session. And over to you, Professor Ken Wilund.
Great. I appreciate that introduction and really excited to be able to talk to your group. We were chatting just before this started about how large this network is, and so I think it's a really good opportunity for us to hopefully get some collaborations between our group, the Global Renal Exercise Network, and your network. That'd be fantastic. We can come away with some collaborations after this. So just a way of an outline, going to do two things today, really talk about GREX, just provide a brief overview of who we are, And then really the focus though is going to be discussing a recent course that we developed, a training course that we call Prescribing Exercise in Chronic Kidney Disease. And this is a course, it's got two different components. Really, there's 8 online modules that are freely available on the GREX website, and then there's an internship program whether we have a 1-week program to provide some hands-on training as well. Just a little bit about GREX. Again, we are, as you mentioned, an international group of researchers, clinicians, patient partners. We have a mission to really improve the research and innovation across a number of different disciplines to develop strategies to increase exercise and physical activity participation and optimize health outcomes in people with chronic kidney disease. A big goal of ours is to facilitate rigorous international multidisciplinary collaborations on exercise and physical activity research. We want to support the development of implementation of different strategies to promote behavioral and lifestyle interventions, both locally and globally, as well as increase the awareness of some of the therapeutic benefits of physical activity and exercise and those with CKD, including amongst patients, caregivers, and healthcare providers. Just a little bit of a history of GREX. We started out really around 2016 at a meeting at American Society of Nephrology. Had a exercise and CKD working group that we sort of established. And then really after 2016, it was a group of individuals that were just very interested in working together, but we didn't have a real formal structure. We started meeting at different conferences across the globe, sometimes at food courts at meetings or wherever a bar, wherever we could find. And we got some money in 2019 from an individual who donated some money for us to get about 75 or so people from around the globe together to really form a more cohesive group. We had a meeting in Calgary and to talk about a number of the issues we were facing. In 2021, we started a group called GREX Young, really to try to get some younger people involved in the program. And at the same time, we were starting to go to a lot more meetings around the globe and develop some research collaborations, as well as some consensus statements on this GREX Global Policy Exercise Barriers and Enablers consensus statement that we published in 2021. 2022 and 23, some more exercise guides and prescription documents, a lot of different conferences, again, we were going to. And then more recent, the last couple of years, again, a lot more conferences and a lot more papers. We just published a couple of papers highlighting in CJSON, a couple exercise-related reviews. And now what I'm going to really be focusing on today is up on the top left in 25, you see here the exercise course that I'll be talking about today, an internship program that's associated with that. And then things I was going to, and talking a little bit about some of the upcoming things we're going to be doing at some meetings across the globe. Another thing that I just wanted to highlight is some of our recent activities in GREX. Some of the different things we're really focused on, including setting research priorities. As an example, the International Delphi survey that we published on exercise priorities in CKD, really focused on developing some practice recommendations. This is a paper that was published in peritoneal dialysis journal, looking at peritoneal dialysis and exercise recommendations for those on peritoneal dialysis. We host a lot of webinars, just like this, like you all do. This is just an example, or how we try to provide some education and dissemination of knowledge about exercise and CKD. And we've got, this is just a map of where we are. We have about 450 members in 40 or so countries. The green areas show where we have membership. This is a little bit exaggerated. We probably have 1 or 2 people in Russia. It looks like we've got half the Europe covered here, or Asia covered. But we're always looking for new members. But really what I'm going to talk about today is, what's next. And really the goal of this whole training program is to try to support implementation of exercise programs across the globe. Along these lines, what we did was develop this course called Prescribing Exercise and CKD. It's a training program for exercise and health professionals. And the impetus for this really was we all recognize that there's a major barrier to implementing exercise programs in CKD, and this is common across the globe, where we have a lot of people that want to implement programs, but they lack the training to do so. Either lack training, they don't feel capable of prescribing exercise or even really helping support exercise programs. An obvious example of this, we know there's a lot of well-intentioned individuals that are, whether it's dietitians or nurses, nephrologists, or whoever that want to prescribe exercise programs. In dialysis in particular, there's been a lot of effort in this around the globe. And we talk about the fact there's one thing that people try to do is an interdialytic exercise program. So somebody gets motivated in a clinic, they buy some bikes, they get people exercising, but nobody really knows how to facilitate the program. So there's bikes all across the world that are supposed to be used for dialysis patients, exercising during dialysis, that are sitting in closets collecting dust, because it's very difficult to maintain these types of programs for a variety of reasons without adequate training. So, recognizing this limitation, the GREX network developed this two-part training program to really try to help address this problem. And we designed a program that had two main components and some online modules that I'll talk about. Really, the purpose here is just to provide kind of a comprehensive overview of concepts that we need to understand how to prescribe exercise and facilitate the implementation of programs. And this is just a picture from, we met in Chicago a couple years ago to help start designing this program. There's a picture of us, and some of you met Paul Bennett, I think, a year or two ago. Gave a webinar for you guys, it sounds like. The second part of the program that João is going to talk about is our internship program. And the purpose here is really to provide some hands-on training to reinforce concepts that are covered in the modules. And here's our website. You can see you can go and take the modules at any time, freely available, which I'll talk about. Again, the first step for this training program is the online modules, and I said there's 8 different modules. I'm not going to read these off. I'll go over these in more detail in the next slide, but it covers a range of different topics. Each of the modules are about 45-minute. They're about 45-minute videos, and then there's a self-assessment at the end of each module, and just so you can ensure comprehension. And then when you complete the course, there's a certificate that we can send out, certificate of completion. Just a couple details about the modules, some of the highlights in each one. The one thing I wanted to mention, there's something in here for everybody. We recognize that nurses and nephrologists and dietitians and exercise specialists all have different backgrounds, knowledge, and interest. And so, some of the modules might be more relevant for some than others. Example, module 1, this is really in some ways focused on people that have an exercise background, but not a lot of knowledge in chronic kidney disease. Probably less relevant for nephrologists and nurses, but it's focused on CKD pathophysiology and treatment, just trying to get some background. A lot of people, exercise specialists in particular, just don't know much about chronic kidney disease, and there's others in that same situation. So it covers things like epidemiology and common causes of chronic kidney disease, just discussing different stages of chronic kidney disease and really what this means for exercise. Some medical problems associated with CKD, complications of late-stage CKD, and helping people understand just really how sick people are with the later stages of CKD that are on dialysis in particular. And again, target audience, a lot of it's for exercise specialists that are unfamiliar with CKD, but others as well. Module 2 is really a really important module that helps try to get people to understand chronic kidney disease from the perspective of the patient. So what we've done, we've had some interviews with some of our group, with some individuals on CKD, and discussing just what their life is like, what their quality of life is like, and what they think about exercise and what exercise means to them. Because when you have a disease like this, it's very challenging to even conceptualize what exercise is about. So they do a pretty good job in there of helping individuals understand, what patients with these comorbidities and this chronic disease, what exercise, how challenging it is. We also have some supplementary videos of some patient interviews on the website that dive deeper into this patient perspective on exercise and its barriers and benefits. The third module is really an overview of exercise and CKD and end-stage kidney disease. Really, it's a review of literature in this population in both pre-dialysis, hemodialysis, peritoneal dialysis, and transplant recipients. And it's focused, talks a lot about the benefits of exercise, but one thing we really want to make sure everybody understands is all the challenges of exercise in CKD, because there are a lot of limitations in the data. We're not trying to be cheerleaders for exercise. We're trying to help everybody understand what the limitations and struggles and barriers are to getting this population of patients to exercise more. Module 4 really is about screening, needs assessments, and outcome testing. So just a lot of some things that for some of you may be fairly evident and self-evident, but others may need backgrounds in how to do medical histories, subjective interviews, how to do functional assessments like walking tests and sit-to-stand test and hand grip test. And there's a lot of variability that can be introduced into these functional assessments if you're not doing them correctly. So we try to go over some of that. Special considerations for exercise for hemodialysis patients, including interdialytic exercise, as well as for peritoneal dialysis patients. Adaptations for doing virtual exercise, on Zoom or what have you. Module 5 is really talking about discussing strategies for exercise prescription. Things like how much physical activity is enough to provide benefits, how to individualize programs and measure intensity of exercise, which is not inherently obvious all the time. How to do that, and really distinguishing between this term physical activity and structured exercise program. So, physical activity can often be unstructured, but there's a lot of benefits to things, lifestyle physical activity, such as going to the grocery store more, just walking your dog, things like that, as opposed to more structured exercise, going to the gym and going for runs and things like that. And module 6 is about behavior change principles and strategies. A lot of nurses and dietitians get some training in this, but a lot of others don't. So how do you increase exercise adherence and exercise maintenance? Describing a little bit about theories for understanding exercise behavior change and how that's why some of these different theories work. Really how to build behavior change skills and communicate these to support changes in physical activity and exercise behavior, and talk a little bit about how to build habits and help people build habits and debunking some of the myths around exercise and CKD as well. Then module 7 and 8, module 7 is focused on class management techniques. So if you want to lead an exercise class as opposed to working individually within someone, how to do this, how to develop group cohesion and set expectations and things like that. Learning techniques also for online program delivery and assessment. And then module 8 is implementation strategies. So how to set up a program, how to set up referral options, and how to incorporate whether it's kinesiologists or exercise physiologists or physiotherapists into your healthcare team. If you look in the literature, one of the things that's really obvious to us is that the programs that succeed the most are the ones where you have exercise specialists in your healthcare team. We recognize that's not always possible, but we provide some examples of how to potentially do that. Sometimes in some countries in particular, there's scope of practice limitations. So some people are not allowed to prescribe exercise if they don't have certain certifications, if they're not a registered exercise physiologist or what have you. In other places, it's easier to do that. And then there's also some ways to evaluate actually, I was using an example, the REAIM network framework, which I won't go into here, but there's a variety of different ways to evaluate the work you're doing. And again, there's a self-assessment at the end of each module, and we can give you a complete certificate of completion once done with the course. And with that, that's all I have for the really the introduction to GREX and the online modules for this course. I'm going to turn it over now to João, who's going to go through the internship program.
Hello, everyone. Thanks for having us. This is what GREX is about, like sharing our knowledge through other networks as well. So I'm very happy to be here. And following on from what Ken was saying, so we kind of put together this internship program to supplement the online models that Ken just talked about with some practical experience. And obviously, we kind of designed the whole idea around a week of training, but of course, this can be customized to a month or even longer if the intern is happy and he has the time to do so. One of the things that is important to us, being an advocate of the training and the education, is that the whole setup is free for the intern to take part on it. And we have some agreed internship sites already across USA, Canada, Brazil, Portugal, where I am, UK, Greece, Australia, and others will always follow. GREX is a ongoing, growing organization, and we are trying to, of course, identify anywhere in the world that provides exercise programs so we can all learn from that. And the idea of the internship program is to have a setup where other people can go and learn from that experience as well. In terms of I don't know if in Africa someone is already implementing exercise, anyone who has an established training center in their own country can apply to become an internship. So we are very open to interchange and to network, as you will see. And our overall goal is to allow dissemination of exercise programs in CKD Global. This is what we want. We want everybody that wants to implement exercise don't have a barrier. So they will be able to look at the online models that are free and then go elsewhere in the world to learn, practice, and then take it back to their home country. So today, what I will cover is like the structure of the internship that is currently proposed. The focus of the internship, and following on from the online learning models, is on content from the models 4, 5, and 6, which covers the more hands-on needed practical content, such as screening, assessment, the importance of standardized outcomes testing, the strategies for exercise prescriptions, and of course, the principles of behavior change. And like Ken briefly touched before, depending on the regulations of each country, of course, depending on the background of the intern, he or she could be able to prescribe exercise or to support the development and implementation of exercise and physical activity programs. So to allow us to do this, we put together some guidelines, and those guidelines and the aspects that I'll cover today of those guidelines, just to share with you, it's the criteria for becoming an internship site, the criteria to become an intern for the person who is interested in taking the models and then apply for an internship. Importantly, mostly, I will spend most of the time talking about the required components of the internship programs, so you can understand what we think is what kind of compulsory for the intern to have hands-on experience and to take part in some kind of practical environment of some techniques of testing or exercise prescription, and then some just like briefly bureaucratic post-internship requirements. So very briefly, in terms of the criteria for being accepted as an internship site, all training sites, of course, must be approved by GREX, which may require or not that we visit the host site and understand what kind of program they are delivering. The primary contact of these host sites must be a GREX member. And of course, you can log on our website and do that as of today because it's free. We are open for anybody to join the network. This hosting site must agree to include training on certain core or required components of the internship programs, and I will discuss those later. And in terms of the application in itself, this must include a detailed description of what the program will be. And this will include a description of the required training components, as well as any additional training that interns are likely to receive. So I won't spend much time talking about the required training components that I'll talk later, but let's say you cover those, but you are also, like we are, an active research center and you are able to provide also research experience, you should also log that in the application so we know, and so the intern knows that he could also benefit from that. Of course, the description should also include information related to the CKD patient populations to which they will have access to, and at least that should be one. Should be pre-dialysis, hemodialysis, peritoneal dialysis transplant patients, or more than one if you have current exercise programs in these populations, and as well as a detailed description of the programs you are currently delivering. And as I said before, the internship site must agree to provide the program free of cost to the trainee. Although we are not expecting them to cover expenses just as travelers, accommodation or subsistence. In terms of the trainee criteria, a primary goal of our program is to provide training to anyone who wants to implement or support an exercise program. And as such, from our side, there are no formal educational requirements that are a prerequisite for this training. However, we must say that some host sites may decline to accept internship applications at their discretion for a variety of reasons, including due to scope of practice, regulations that are important to their countries. From our point of view, the only formal requirements that are required for a host site to accept an intern are that all trainees must have completed the online GREX training models that Ken just described, and you can do that at your own time, free of cost, and throughout the internet. And then trainees must contact the GREX internship training site, complete and submit the application that I've explained before, and agree to the terms and conditions that are explicit there. In terms of the components of the internship program, we kind of design the areas that we think that this hands-on program or internship program should cover. And these cover from the recruitment of patients into the program, which should include discussions on how to approach the patients, the importance of developing relationships to understand the exercise experience, barriers and motivators towards exercise, as well as, of course, screening requirements, how to screen the patients to determine their eligibility for exercise programs. So contents such as obtaining the consent, the medical review, and subjective interviews to understand the topics I've just explained before. In terms of assessments, we think that conducting tests to assess the participants' physical function and exercise capacity, including their cardiovascular fitness, strength, balance, flexibility, and body mass composition, should at least cover some core techniques from the functional tests we believe that are most used to these populations, and these are the SPPB, or the short physical performance battery, which includes the 4 meters gait speed, the 5x6 to stand test and the balance test, and the hand grip strength testing. But of course, When possible, it should also include other functional testing, such as the 6-minute walk test, shuttle walk, or other shuttle walk tests, time up and go, variations of the sit-to-stand tests, flexibility testing, and as well as body mass composition testing. Other testing, not so functional, but also important for assessing the interventions, can include quality of life, cognition, depression, and patient activation measures. Here I should highlight that our belief is that when you talk about assessments and the importance of course, an intern can look at the website and learn what are the important tests. They can look at the instructions, that they can read the instructions and then try to implement, but it's good to have some practice. And just as a way to highlight, there is a need to practice the test when you implement, to avoid learning effects during the test. So for example, if you are to use a test before and after an intervention to monitor the effect of the intervention, you should do those in the same conditions. And to do those in the same conditions, it's important to have consistent instructions. And when I'm talking about instruction, is even the script of the information you transmit to the patient. So all of that will be covered, and we expect that to be covered in that internship experience that the intern will have in a proper immersive setting with a proper patient. In terms of the principles of the exercise prescription, that of course the other one of the most important components of our program, and it's important that this should include practical demonstrations on how to prescribe exercising using the FIT-VP principle, or the exercise prescription principles that I'll touch a bit at the end. Also methods of monitoring exercise intensity, and how to incorporate lifestyle physical activity on top of an exercise prescription. Because sometimes we talk about the exercise, which is a component of the physical activity, but it's also important that that exercise translates into a behavior change that makes the patient become more active in their lifestyle, and not only when they are performing exercise. And then, of course, touch on principles of behavior change. Behavior change techniques utilize that each host site are likely to be differently, so there is no requirement for any specific theories or principles to be taught during the internship. However, every host site should emphasize the importance of setting specific goals, reinforcing positive behaviors, modifying behavior gradually, providing feedback, modeling desired behaviors, utilizing motivational interviewing techniques, and considering the individual stage of change within the trans-theoretical model. And then implementation strategies. We kind of tailor the whole internship prescription, experience in a way that then the intern will take this back to their home country. So the way we envision that the implementation strategies should be covered in the internships is in a way of making an assignment where the intern will have to develop a written plan that details how they plan to implement an exercise program in their own clinic, and taking the opportunity they are in a setting where they are already implementing exercise, and discussing that, including topics of what research they will have access to, who can and will be able to help them run the program, as well as designing the principles of the basic program that they can then take back and implement. So very practical and pragmatic advice, and making the most of the time when the intern is in a setting where exercise is already being implemented, and taking that time to discuss that with people who have already the experience in doing so. And then finally, in terms of post-internship requirements, of course, after the internship, the trainee will be required to fill out and submit a brief report to GREX, discussing what they learned during the internship, as well as critiques, suggested areas of improvement for the training program. The supervisor from the host site, of course, will complete a brief assessment of each intern that completes the training at their site and submit this to GREX as well. And then GREX will provide a certificate of completion once all the requirements have been met. So, and that kind of sums up the way we envision the internship component of our exercise program. But another way we are trying to promote this, being conscious that not always will be the people will be able to travel to a different country by lack of funding or time to spend some time learning about the programs. We want to make the most of international conferences, and of course people in the nephrology community around the world, being a nephrologist, dietitian, exercise professionals or other health professionals that are involved in the nephrology care and are interested in exercise, but they have funding to go to a particular conference. Another way we thought that we could promote some practical components to supplement the models was to develop some demonstration workshops in those conferences, the scientific conference, pre-conferences, and I'll tell you in the next slide a few conferences where we're already committed to do so. And basically, the objectives of these workshops are to similar to what we are doing today, so provide an overview of the GREX training program, and then having a practical component to demonstrate some key aspects of the training, for example, the assessments and the exercise prescription principles, as well as discuss how to take that information into practice in their home countries. And you can see here the format we are currently thinking. Typically, those workshops will have some kind of lectures where we discuss a bit more in detail the benefits of exercise, the current state of the literature. We present the online models and the internship model like we are doing today, and then we go for a practical component where we demonstrate specific aspects of the internship programs in a workshop format. And for you to know, if you happen to be planning, or some of you are happening to be planning to attend any of these conferences in this year and in 2026, so we will be hosting a pre-conference workshop in the EDTNA in Porto, where I'm currently next October, and then in September we'll be hosting GREX is formally affiliated with ISRNM, and we will be hosting a pre-congress workshop there in September in Germany. So feel free, if those conferences are of your interest, and if you happen to be there and are keen to develop exercise in your units or in your current settings, feel free to join us. We won't be charging any extra for those pre-congress workshops, so this is just about disseminating and knowledge exchange. And finally, since we still have some time, just to tell you about this paper that can briefly mention that you can look at, and has a sum up of some of the concepts we also have in more detail, obviously, in our models. But just to touch on the kind of knowledge that is important to understand from a practical perspective, and touch on the principles of exercise prescription, for example, and those are frequency, intensity, type, volume, and progression. And of course, when we read the literature and we follow the evidence base in terms of frequency, intensity, time, type, it's typically easily translated into a prescription. So let's say patient will exercise with a frequency of 3 days a week, typical literature in dialysis setting. That will be the typical prescription because those are the times that patient is available in the dialysis unit. Then intensity, people talk about being moderate, but not always understand objective measures or subjective measures of monitoring that exercise intensity, and that those are the concepts we will put, you will learn in the models, and then we'll put into practice in the internship. Time, of course, is the duration. Type will be aerobic or resistance exercise, but just briefly mention that volume and progression are very important concepts, especially progression, because when we recently review all the evidence based about exercise prescription, for example, in dialysis patients, we kind of noted that not always is explicit what is the adjustment in progression. I'm not saying that they haven't done it, but because it's not there, people when try to translate to their own settings, sometimes it might fail to adjust that principle of training. And progression is very important. So if you don't progress all the other principles, you will fail to induce an adaptation. So if you don't provide a stimulus that is progressively adjusted, it will be very difficult to have effects. And this is just to highlight the importance of having this learning from the online models. In our models, we cover all of this from a theoretical perspective, but it's very important that then you go to a place where people are using it, or you try to come to one of our workshops, in which case we will work mostly based on case studies like this one, where we have a case study of a patient, and then we ask you to try to prescribe the exercise, and we provide feedback. And these case studies are also covered in the paper I've mentioned, so you are more than happy to have a look at the paper, or we can share with you if you are interested in, and just feel free to reach out. And that's it. Thank you very much.
Thank you, Dr. João. Thank you also, Professor Ken, for taking us through the GREX training program, taking us through the modules that you cover, and also the available internship opportunities. I think it's something that we can, of course, utilize and also learn from. Just to jump into the Q&A section, there's one question by an anonymous attendee asking how does one access the online training module and whether it's free?
I can add, Ken.
No, go ahead.
Yes, so all the models are available in our website, and it's freely available. So all you have to do is log on the website. We can share with you, so you can share with the network again the link. The link was on the presentation. We can also copy and paste on the chat here. You just log on the website, the models will be there, and it will take you through.
Yeah, I'll post the GREX website. And then you go there, there's a education and resources tab on the GREX website that you can find it. If not, just email. And somebody else asked for the PDF, and I'm happy to provide that as well. Yeah. Just maybe if 100 people email me, I'll send it to.
Yeah. Yes, I will suggest. I've just pasted the direct link to the models on the GREX website.
Okay.
But of course, feel free to also join GREX community. It's very, as you've seen in our map, we didn't have much Africa coverage, so it'll be good to have some Africa members. And in terms of the papers and everything else, we can just share with Lloyd, and then you can share with all your network.
Yeah. That's the best way.
I have sent out to everybody a PDF with the GREX website link, as well as that's to register to become a member, and also access to the course, a link to the course, and introducing GREX as well. There's a PDF sent out. If anybody has not got it, please put your email on the chat, and we will definitely send it to them. Thank you.
So
Thank
I
you,
see
Dr.
one
Lloyd.
question in the chat. Would you like me to the one about the
Yes, from Dr. Amar. Yeah, you can take it up.
Sure. So if you're not looking at that, it says, how would I best advise a 27-year-old poorly controlled diabetic, type 1 diabetic with CKD3 with worsening renal function who consumes dextrose gel? Oop, I just lost it. Dextrose gel to fuel daily endurance running. So this is a complicated question. Very good one though. So someone is running marathons or races in excess of 10 kilometers. I mean, this is a complicated question, of course, but I think one thing I would certainly, a couple things come to mind, and João, you can jump in here as well, but really important to, if you have access to continuous glucose monitoring to track glucose in real time during and after exercise, it's really going to be impacted just by the exercise alone, much less if you're consuming a dextrose gel, which is pretty high in glycemic index. That'd be the first thing, just making sure you're really monitoring it, and which they may not be because it's poorly controlled. But also, as opposed to dextrose gels, there's just some other things they can be taking to fuel their runs. Lower glycemic index options, carbohydrate options, whether it's fruit or other snacks that that aren't absorbed quite as quickly, so more slowly absorbing. That might be something that especially once you see the impacts, if you can do continuous glucose monitoring, you play around with that to see if you can dampen the spikes and drops. Those are a couple things. I mean, it's hard to say definitively everything it would do with this individual, but those are two big ones I would focus on initially. I don't know, João, do you have anything to add to that?
No, I agree. And as well as having nutritional support, I would say, for someone doing this, like obviously monitoring is important from the exercise perspective. If the person is being followed, it will be good to have a nutrition support to help out in this type of situations.
Thank you for that. There's another question in the QA chat box. I think asking on criteria for joining in terms of the cadres that can join the program. So they're asking whether they could participate in this training if they are exercise physiologists but not medical doctors.
Yeah. Yes. What is the question?
Whether an exercise physiologist can participate if they are not medical doctors.
Yeah, of course. Well, that's the whole point. I mean, in terms of the models and then the internship as well, our vision is to provide, that's why we call it an exercise program for exercise and health professionals. So, of course, in terms of the models, like Ken was saying, some will be more basic or more detailed depending on your background. But we actually had that kind of discussion. Should we do a program for each particular background? But then we decided that we wanted to give a base that would be common to everybody and anybody who wants to develop these skills and competencies. And then it's all about the internship side of things when you go to a different center, and then you will have the opportunity to tailor that to your specific case. So if from our side, from GREX side, it's for anyone really. That's how we envision this. I don't know, Ken.
Yeah, I just wanted to reemphasize another thing I said. There's just because the scope of practice requirements in different countries, they're going to vary significantly. And I'll just use an example of Canada versus Mexico. We had a number of collaborators in GREX from Canada, and when we were even going through how we would design this, especially the internship, they were saying if you're not a certified clinical exercise physiologist, you can't prescribe exercise or really even do much with the patient. So this course for that group would be really just how can a dietitian or a nephrologist or nurse support a program without doing the actual prescription. So we have stuff there for that. But in Mexico, or even in the United States, really, probably a lot of places where the scope of practice regulations aren't as stringent, we have people, nurses, dietitians that just start an exercise program and they're prescribing exercise, and they're not getting in trouble for it. They don't know what they're doing unless they get this background. So it's for them as well. But it really, this course, the benefits and how you use it will depend on where you are and what the regulations are in your country, or even in an area within your country.
Thank you for that response. I think there's just a comment from one of our kidney supportive care nurses in Kenya. He says that he is originally a palliative care nurse, and his comment is that during the Kenya Nephrology Nurses Association meeting last week, they were able to discuss physical exercise, and he's indeed proud that we are discussing this now. I think, again, the program will probably help many in terms of CKD, exercise and CKD. I think there's another comment or question from Dr. Amar, who says, follow up on that. He does have, I think, again, the case that he had put forward, say that he does have CGM and he eats twice daily at his father's owned restaurant with no limitation in salt intake. He hovers at between, I think his sugars are between 8 to 18 millimoles per liter, depending on time of the day. My struggle is real.
Yeah, it is
I'll
real.
leave it to Ken.
Hey,
Yeah.
thanks for the easy question. First of all, two comments. One, I'm a bit of a salt hound for a
Yes.
variety of reasons, and the no limitation salt intake is very concerning to me for a variety of reasons, just related to cardiovascular disease risk, potential for volume overload, even in pre-dialysis CKD, that can be a concern. But this reeks of somebody that needs really to be working with a dietitian, because it's hard to really provide any prescription based on this information. I agree, the struggle is real, and again, I would just emphasize that the dextrose, I would really try to not really encourage them not to use that, especially they said 10Ks and above. So if you're running marathons, you absolutely need some nutrition during the run. But again, it doesn't have to be dextrose. It can be something with lower glycemic index, and it can and on the training days, they're running 10Ks or less during their training. They really don't need a whole lot of nutrition during those to fuel the exercise. Now, their glucose may be going up and down, and I don't know, and that's what the CGM is for. I wish I had a magic wand answer for you, but they need to be monitored closely by a dietitian.
Thank you. Dr. Amar, I hope your question is answered. Just one last comment from one of the participants, I believe from Kenya, who says that since we are from a lower middle income country, we hope you will tailor the training according to the situation.
Yeah, I can comment on that. Of course, that's part of our goal as well, to reach anywhere in the world. And of course, the theoretical basis of what we teach in the online models, are the principles of exercise assessment and prescription. And then in terms of the implementation strategies, that's where that will come in. And of course, we will be more than happy to either promote a workshop in those kind of settings and trying to learn what it's needed to adjust exercise into those settings, as well as hosting people from those regions and try to tailor in that implementation strategies components of the internships what will be easy to adjust. But exercise, it's not very expensive if you think of course, if you think about buying exercise equipment for a dialysis unit, it could be, but there are options to promote physical activity and exercise at a very low cost. And of course, we will keep that in mind.
All right. I think that was the last comment or question. I'm not sure if any of our participants has any other comments or questions. Kindly feel free to unmute and ask a question or a comment. I don't know whether Dr. Lloyd, Dr. Amar, or Dr. Maza has anything before we close.
Thank you very much for the introduction to GREX and the online module and the internship. I think it was it's something really good. We certainly would like to encourage our nutritionists, nurses, kidney supportive care people to actually take the online module, and also maybe I was wondering whether we could actually have an online workshop for those who have actually gone through the online module. If it's possible, sometime if there are some, even if these workshops or these are in the form of webinars that are put online, it may be of use, practical situations where you tackle the common problems, exercise in common problems. That would, I think, be useful for people who are either, who is either a nutritionist or a nurse or even a kidney supportive person. I mean, some sort of an idea on prescribing if a patient asks, and of course our physicians as well.
Yeah.
Yeah.
I think can I go? And then
There you go.
So I just to sum up from what we've been describing, our way of describing internship and workshop was more like to have an hands-on live experience to supplement the online contact. But I understand your point, and I agree. I think for these kind of settings and in the way of try to promote, it would be useful if we make sure the people who attend have already first taken the model, so we know we are all at the same level of knowledge in terms of what they've been through, and then doing a session that could have bits like you've described of common problems, common challenge, but also an open discussion in small groups where we can, of course, advise people to the challenge they currently face. For us, as GREX, we'll be more than open to have a follow, like if you want to put together something following up for the people who have taken the model and are trying to implement, but are not able to travel to an internship site location and are able to join an online discussion with us. Me, Ken, and other members of GREX will be more than happy to support you. That's what GREX is about. Yeah, knocking any barrier that avoid us to get that step forward in implementing exercise anywhere around the world.
And if you all do have videos of the workshops that you are going to organize, both at the EDTA and elsewhere in September in Germany, it may be good if we could actually put it up online, to see those discussions. If you could just even the raw videos, we could edit it and put it online. It'll really be nice, very useful as well.
Yeah, we will try to do that. That will depend on obviously the facilities of the conference in itself in terms of the quality of what we will provide. But I would just like to comment on that in terms of we will be happy to do that and to provide that. But what we don't want is to say if you do the models and then watch a video, we'll be okay to do it. We would also want you to try to get some kind of communication so we can understand the real challenges that people will be facing in their current settings. That's what the practical experience is about. Some of the thing can be the standardized, like you are saying, and we can try record videos, common problems. This is how we should be doing, standardizing a case study, but a lot of, and the richness behind the internship and the live content, it's the actual interaction and trying to get our knowledge. When I say our, it's not myself, it's the community that is already implementing exercise towards someone who is facing the initial challenges of trying to do. So just like in a way of trying to speed up and don't let people fall on the same problems that we already know that might be a problem. But of course, not knowing what they are facing, and each country can have specific conditions that we don't know. We just don't want to say this is it. I think I make my point clear.
I just want to add one quick comment. The ISR&M workshop in September is actually that meeting got postponed from 2025 to 2026. So September 2026. Don't show up in Berlin this year.
No, it's there. Yeah. It's there.
Yeah. In Porto, that meeting is this fall.
October.
Yeah, but then ISR&M got pushed back. Anyway.
Yes. And the last thing is, how do you set up a center? Like, for example, if we are interested in setting up a center for exercise therapy, how is that center set up? What is the process, and how do you train people there, and how does it look like?
Well,
go ahead, Joe. I mean, it's, this is stuff that we will be covering. That's covered a little bit in the modules, but more in the internship program to start a exercise program. I mean, that's really what the course will help do. Is provide examples of how to get a whole program going. I mean, I'm assuming that's what when you're saying a center, just a program for the center. It's really, I think the best advice would get as many people that are interested in participating in that and getting them to take the modules, and then from there, hopefully we can get at least a few people, 1, 2, 3, what have you, to come do the internship program. You might be able to, again, get away with not doing the internships, like if you can't get people to come, but we strongly advise it just because the hands-on part is so critical. You can get it going, but as I mentioned, there are failed programs all over the world because people just don't have the knowledge and training, and that's what we're trying to do. So I don't know, Joe, if you want to add to that, but that
that's what I'm going to mention is like the first thing I would advise in terms of implementing a program from a nephrology center that doesn't have a program is first to have the interest in doing so from like the administration perspective. And then if you have that, then identify people amongst your staff that will be key persons or the exercise champions. And that needs to be people from the medical doctors, the nephrologists, the nurses, and whomever you will have in your setting, depending on where you are, and get that people, that team to do our models. Then we will be happy to talk to them if needed. But like Ken said, if you have funding, to send them to, one or more locations and learn what others are doing in programs that are already implemented. That experience, when they take back, will be I'm sure enough to have a successful implementation program. But of course, that cannot not be only, okay, I have one person that will go, and then the people who are above that person in terms of leadership don't allow them to have time to do that. So our program was designed to anyone, but you have to give these people time in their day-to-day to deliver. That's another problem we identify. So a lot of programs are run by the existing staff, but then they become problematic if people are on very demanding shifts and they have to do their duties that are of course most important for the medical care and are not allowed sufficient time to dedicate to the exercise component, similar to any other healthcare matter.
Just one thing to add to that, there's a lot of programs around the world that have been very successful. There's been a lot of failures, but the ones one of the characteristics of successful programs when the nephrologists are sort of mandating it. If it's led by, you know, the nurses, the dietitians or techs, you know, they can be successful, but really getting buy-in from the nephrologist and almost, you know, that, hey, we're going to mandate this program and it's coming from the authority in the clinics, that is so important. It's important to have exercise specialists, you can get it, but it's also important to have real buy-in from the nephrologist, say, hey, we're going to do this. And so João and I were involved. There's a paper we wrote a number of years ago, had examples of programs that were successful. We highlighted his program in Portugal. We highlighted one in Germany. I believe there was one in Canada, I think, and then there was one in
Mexico.
And the one in Mexico was really interesting because I'm not necessarily saying this is what should be done, but the fact that they were able to do this was just incredible. It was the nephrologist at the clinic, small clinic, had mandated that all of their patients would either cycle or use resistance bands during dialysis for the entire shift. And they had everybody in the clinic, there were 35 or 40 patients that would exercise for 4 hours, very low intensity. I'm not even saying this is necessarily the right thing to do, but very low intensity. They were you know, doing their resistance bands even during cycling. And they had told the fellows that were rounding that if a patient fell asleep, you had to wake them up and they had to pedal. So it can be done. A lot of things can be done when it's being mandated from the top. I'll just put it that way.
Yeah, that's a very good point. Very good point. And how long is the internship, say, in one of the centers?
Well, the way we design it, like I described, we put a week, but it can be customized. Week is the minimum, I would say, to get through all those important bits we think people need to get experience. But it can be longer if you need it. You know, if you feel that people need more experience, it can be longer. But that's why when we put the hosting criteria, the hosting site criteria, we want to know when which populations the sites are working with, and then we will match that with the intern that wants to go to an internship place, and then we'll cover from recruitment of the patients, screening, physical assessments, exercise prescriptions, and then discuss how to take back to their countries. And I would say at least a week will be needed in places where the program is clinically running every day.
Yeah, thank you. That's very useful. I think it's a good suggestion. If it's nephrology driven, I think it will be definitely successful too.
Yeah.
So that was a wonderful exposure, and I think a lot of knowledge that we've got. And I think it's important that we actually build this sort of a program within our organization, and we'll have to see how we can actually, you know, build and implement the same so that it reaches our patients on dialysis. I guess not only dialysis, also into the CKD clinics that they should slowly start. Yeah, if the nephrologist is involved.
Yes.
Yeah.
Very important. That's an excellent point, because of course, dialysis is where you have much more evidence, but in my opinion, and I believe Ken shares the opinion, that's just out of convenience, because a lot of exercise research has been done in those settings because you have easier access to the patients. But pre-dialysis CKD, it's where you should start, and it's where exercise will have most benefits, in my opinion. And if you have a setup where you can do that, that will be excellent.
I just want to say, this is where we've run into a lot of problems also, because when people think about exercise in CKD, they think about, a lot of people just think about interdialytic cycling, because that's where there's so many studies been done. And those programs, honestly, they're really beneficial for 5%, 10% of the patients, but they're really difficult to keep going. And they're boring. People don't like to do the same thing the whole time. And if that's all, you know, we do is buy bikes and stick them in front of patients, the program's going to fail for most people. And that's really the essence of what got us together and what got us thinking about all these problems. It's got to be more than that. And the exercise prescription is so much more than that. And that's what the course is about.
Yeah. I have one question to two of our nephrologists, Dr. Amar and Dr. Mazhar. Does NHIF cover physiotherapy? Dr. Amar, Dr. Mazhar, does NHIF cover physiotherapy? Because if we get our physiotherapists also involved, we can actually send them to physiotherapy from the clinic, right? So I don't know, Ken, if this is a model that you all also have anywhere in the clinics there, where like the physio people actually, you know, teach the patients the exercise.
Physiotherapy, for example, I have experience in Brazil, and a lot of the clinics will have physiotherapists rather than exercise professionals. As we try to evidence, we are not about the background of the person. We are about any person that has dedicated time to implement exercise should develop certain skills and competencies that we are trying to promote, should gain certain experience in, and then off they go if you guys at the top still give them time to do it. That's the main of the thing.
We do have some access to physiotherapists. I mean, there's certain codes we can prescribe if they have physical function deficits or wasting or what have you, they can get physical therapy. But they're not in the clinics themselves. They have to get referred to them. But we're trying to start, one of the things we're trying to do now is work with some people that there's opportunities for remote therapeutic monitoring that the clinics actually in the United States can get reimbursed for doing this. So the clinics will actually make money if they sign people up for these services. Right now, that's okay. We don't know with the current administration if that's going to stay. But that's if you have access to it, but the physical therapist would also benefit from this, even though they can do physical therapy. Exercise prescription is different, so getting them to understand some of the issues that we go over in the course would be.
But overall, and even in GREX we have like people like myself and Ken, we are from exercise background, but you also have nurses. You have a lot of physiotherapists that have done a lot of research in exercise. Okay, going what Ken is trying to say, and I think it's a good point. Is like if we just do this in a physiotherapy setting that are not prompts towards exercise, that might not be enough. So, but on the other hand, if you have physiotherapy time and reimbursement strategies, like I'm seeing here in the chat that some countries might have a reimbursement for physiotherapy, then my advice would be get those people involved, get them to take our training, get them to talk to us, and then they might be able to help you move forward.
Get them to take the training, get them, to learn, go through the internship and things like that, and then, get them to do it. Then there's that motivation is there. That's the thing.
Yes, because typically in settings where they are not thinking about exercise from this perspective, physiotherapy comes in when you have some kind of movement restriction, when you are in a very debilitating orthopedic condition, and not so much from a general overview perspective, which we of course can help as well. So in places where it's in an ideal world, if you can have them all, even better, of course. In multidisciplinary teams, in an ideal world, like for example, in cancer rehab these days, you have exercise professional, physiotherapy, nurse, you have all these professionals promoting the quality of life of the patient. But we know we are not there, and that's why we try to have a model where it's all about the skills and competencies we need to develop to make sure people know what they need to know, and not so much who they are and what their background is.
So there's another option here is that there is an ISN program that funds for an ISN ambassador who's a specialist in an area to come down to spend a week, in places. So that could be an option. Do you think that would be a good option if you consider Africa?
Yes, that's another thought we also had in terms of even ISN fellowships program. If you guys can have access to funding to support this, we will be we'll be more than happy to sign off whatever needs to be signed off.
Yeah,
and suggest locations that are, you know, closer or cheaper depending on the funds you have available.
Yeah, yeah.
And then in my view, in that way, what you could then do is try to have one place in each country that you currently support that will be the center, and then we can build from there. You can build from there.
Correct. Yeah.
That's what we're hoping. This is such a great opportunity that we're, again, you get one center and grow it out. We've got a few around the globe, but we need something in Africa. We need more, and that would be great. If, really highly encourage somebody, if they're interested in developing a center, to go through this and let's get it started. This is the reason we're here.
Yeah, yeah. Thank you so much, Ken and Joe. I mean, this is a wonderful, you know, it was a wonderful session. Give us a lot of information, and I think a very important area that I think we really need to focus as well. So we've got nutrition, we've got kidney supportive care. Now this is another aspect that we really need to, I think, look into and see how best we can actually work out and maybe get a few centers on board and then get it going. Thank you so much for your time, and I think it was a very fruitful discussion, and we will keep in touch. And of course, if there's you know, we would also be interested in doing some research work. I'm sure there'll be a lot of people who would be interested. So if there's a topic or two, we would actually also like to reach out. And then if there is an interest from your side to just guide overview, that will also be really nice. So we can publish something.
Okay. Yeah.
Happy to.
Happy to.
Great. I really appreciate everybody's time. That was a great question and answer session also. So I appreciate your attentiveness and interest. So looking forward to hopefully more discussions.
Yes. Yeah,
Thank
me too. And I thanks for the opportunity, and I also strike that we are more than happy to collaborate in any ways you see that can promote exercise into your region.
Yeah. Thank you so much. Definitely we'll work on this. Thank you.
Thank you.
Okay.
Bye now.
Thank you.
Thank you.
Take care. Bye-bye.
Bye.